America's hospitals and health systems are at the center of their communities, both as providers of critical services and as large, and often the largest, employers. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Petterly, senior writer at AHA and your host. The AHA advocates for policies that advance the health of communities. This combines near-term policy goals with longer-term strategic planning, and that includes the changing healthcare workforce. The healthcare workforce is essential to the critical mission of providing life-saving care. While workforce challenges are significant, there are many opportunities available for hospitals and health systems to improve care, motivate and reskill staff, and modernize processes and business models that reflect the shift toward providing the right care at the right time in the right setting. To develop actionable solutions, the AHA launched the Changing Workforce Task Force in the fall of 2019. The task force is charged with developing bold, new ideas to advance strategic thought leadership on the future of the healthcare workforce. The chair of the task force is Cathy Jacobson, president and CEO of Froedtert Health in Milwaukee, Wisconsin. In this podcast, she is speaking with Joy Lewis, vice president for strategic policy planning at AHA.
Cathy, thanks so much for joining me on Advancing Health today.
Thank you for having me, Joy.
Okay, let's dive right in. Can you describe the charge of the Changing Workforce Task Force for our listeners who may not be familiar with this group?
Sure. As hospital leaders, we all recognize the multitude of challenges facing all of us: funding, regulatory constraints, operational and clinical changes, just to name a few. But many of us don't know how to prepare for the next generations of workers and the roles that they might fill. We are also often the largest employers in our communities we serve, with a vast impact on the local economy, so top of mind for all of us. That's really why the AHA launched a task force on the changing workforce, comprised of 24 hospital and healthcare leaders from across the country. This group of leaders help the AHA explore healthcare workforce challenges, identify future trends, recommend policy and advocacy changes, as well as key operational considerations, and help raise awareness of workforce issues among the healthcare field. I accepted the role of chairing the task force with this in mind. Healthcare is taking care of people and depends on people, and I have always focused on how you get the best people into this work. And while we cannot fully predict what jobs hospitals will need in years to come, the AHA and hospital and health system leaders continue to work together to provide important and timely thought leadership on this topic.
So we know that the healthcare landscape continues to change rapidly, whether it be technological advancements, or growing consumerism, or predicted clinician shortages. What do you foresee as the top healthcare workforce challenges over the next 5 and maybe even 10 years?
Sure. We definitely do not have time to cover all of the upcoming workforce challenges that so many of us see, but there's some common themes. So you already mentioned some of these: anticipated workforce shortages, the role of technology and advancement, training and leadership opportunities, the cost of workforce training, managing workforce violence. These are just a couple of the few issues that we need to consider. A skilled and robust workforce is essential to the delivery of high-quality care. A major obstacle to building and nurturing a talented and dedicated workforce are the shortages in so many key healthcare professions. These shortages can strain a hospital's care delivery and finances and aggravate other workforce challenges such as burnout, and can lead to really costly mitigations. So that being said, these challenges present also a distinct opportunity to be creative and forward-thinking while developing the workforce of the future.
From our workforce task force meetings and my conversations with members, we inevitably end up talking about, quote unquote, the workforce of the future, which has a very intriguing spin to it. What do you envision for the healthcare workforce of the future?
That's a good question, though I don't think that anyone can fully predict what the future will entail for the healthcare workforce. But I do think that it is a very exciting time to be working through the possibilities with this task force. During our discussion so far, the group has emphasized the use of and the importance of thinking of bold ideas. The challenge is to balance the known, anticipated healthcare challenges that are right in front of us, like the ones I described earlier, with the unknowns of where the healthcare industry will take us. We want to be ahead of that curve to create solutions for the healthcare workforce that are human-centered, digitally enabled, which we know will be important, team-based, and promote increased job satisfaction for the people coming to work every day.
I want to acknowledge that hospitals are already engaged in innovative practices. We've heard examples from task force members of telehealth integration, of creative community partnerships, and just so many more ways in which they are already innovating. Can you share with our listeners just a bit about the role that innovative practices play in the healthcare workforce?
Sure. And like you mentioned, Joyce, so much of this has been going on now for a number of years. And I would say particularly in innovative new technologies being introduced to healthcare and really driving the need for our healthcare workforce to have to adapt and adopt to be able to make the most of these technologies. Really, I would say, starting with the introduction and integration of telehealth also as well. I know we'll touch on our current pandemic and how that is really just accelerated in light of keeping people safe. But there's other tools that are out there also as well, like ways to communicate digitally with our patients, use of apps that can actually manage your condition. I know my own health system has been successful on integrating apps to manage depression or to manage your diabetes when you're not within our four walls. There's artificial intelligence that's out there that actually can be used along with chatbots to actually direct patients to their appropriate level of care given a conversation and a review of their symptoms, whether they should be getting an appointment with their primary care doctor, going to an urgent care, a virtual urgent care, a walk-in, or actually having to go to the emergency room, just all these different kinds of things that are out there. And we're using remote monitoring more and more to put more care in the home, all the way up to some health systems who are actually developing hospital and home capabilities. So there's just so many different routes that are out there right now with all of this different technology, and making sure that our workforce is trained and adaptable and can really adopt and transform the way we take care of our patients is really going to be critical to the future.
So over the last 2 months, our field has been rattled by the spread of COVID-19 across the United States and the globe. Thinking about this through your lens as a hospital CEO, what does a pandemic like COVID-19 teach healthcare leaders about their workforce?
Wow. First and foremost, if you ever have to be reminded how brave and hardworking the folks on the front line are, we have definitely demonstrated that over the last couple of months, and just have a whole new respect for the people who come in and take care of our patients every day. Very faced with high stress work environments, managing crises, and every single day, courage, flexibility, tenacity, coming to work in very, very stressful conditions. And I just, your respect has just grown immensely. It also teaches all of us as healthcare leaders a lot of lessons about how we need to be preparing and supporting a resilient workforce, because this has been really tough on folks. So being able to provide continual learning and professional development opportunities that really can help strengthen problem solving and leadership skills when we're faced with something new and unprecedented like we've seen. In addition, developing good communication and connection with teams is essential also as well. We think if we can create that resiliency around our workforce, it's really going to promote a better sense of control and confidence, and encouraging connections among each other, the teams, among employees when they're working with each other. And that way, when unpredictable situations occur like this, the workforce just isn't feeling left unsupported or unprepared to manage through these challenges. It's really exposed some opportunities, I think, for all of us.
Yeah, I would agree. And while we certainly hope we don't have another experience like this one, we want to learn from and prepare for. So in closing, from your perspective, is there an issue related to the changing workforce that simply does not get enough attention?
Sure, and I think it's a broader population-based issue that we deal with our patients, but it's very relevant to our workforce, and that's really paying more attention to the role of social determinants and behavioral health and how it affects patient populations, but also knowing that that has an impact on our workforce also as well. So historically, social determinants and even behavioral health were treated kind of outside of the scope, of a patient's treatment plans. But we've seen more and more organizations place a larger emphasis on prevention in the community as a means to decrease unnecessary utilization and improve patient outcomes, because we know this is having an impact on health outcomes. So, for example, there's leaders that are developing training and team-based care models to incorporate what we may think is non-traditional healthcare workers in the workforce, such as community health workers, doulas, peer-to-peer supports, and people traditionally maybe we haven't seen in our workforce. In addition, our workforce isn't immune to the effects of social determinants. Individual level factors such as education, income, stress level have an impact on workforce supply and employee productivity every day. So increased attention to social determinants of health can help improve the employer, meaning us healthcare systems, ability to plan for future workforce shortages by investing in early training and development opportunities. The investment in social determinant planning has the potential to strengthen our own human capital and better meet the needs of the workforce, as well as helping our patients.
So, Cathy, I really want to thank you so much for a rich discussion and for reminding us that change in the healthcare workforce is imminent, but it also presents untapped opportunities. And so we wish you and the task force continued success in your deliberations and look forward to tracking your work as you advance thought leadership on this very important topic.
Great. Thanks, Joy, and thanks for having the opportunity for the conversation.
You've been listening to Cathy Jacobson, President and CEO of Froedtert Health in Milwaukee, Wisconsin, and Joy Lewis, Vice President of Strategic Policy Planning at AHA. Their simple message: there is no time like the present for thought leadership on the healthcare workforce. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for joining us.